you ever heard of ankylosing spondylitis? A few of you have. On the x-ray, we'll get another volunteer, thank you. On the x-ray, when we look at the person with ankylosing spondylitis, what we'll see is in the very bottom of the spine is the sacrum, the tailbone at the very end, the iliac crests that come around like this on both sides, and then above that are these larger lumbar vertebrae. And the larger lumbar vertebrae give way then to through the 5 segments, and if I can, I'll just step in front for just a second. When we look at this spine, what we'll actually see is a presentation where normally on the x-ray what you'll see is an appearance that reminds me of an owl. And you'll see these little owl-like appearances that basically become, this is the spinous process, what you can feel in your spine, and these owl eyes are actually the weight-bearing portion of the spinal canal that then gives way to the joints. And these joints actually come down and connect the one above to the one below. And what you'll see is on the ankylosing spondylitis, this will actually become what they call a bamboo spine. So it will actually start to look like bits of bamboo down through the spine. And all of this becomes connected. And then the other description is the sword or cane spine, because all of these will actually become connected as well in the appearance of on the x-ray. Okay? Now the fascinating thing about most of this type of flowing hyperostosis, or where the ligaments are actually becoming calcified, and so this whole spine becomes bamboo rigid. Okay? What you'll actually see in this flowing hyperostosis is that, have you ever heard of someone that's had a heel spur? Has everybody ever heard that phrase, a heel spur? Oh, my spouse had a heel spur, he had so much pain. Or plantar fasciitis led to a heel spur, so he had to go in and have that heel spur removed. The orthopedist that I have visited with and done rounds with, when you look again at the x-ray, the heel bone comes down like this, and what you'll see is that this calcaneus or heel, where the plantar fascia attaches to this bone, will actually start to avulse or pull away. And in an attempt to heal, the body will quickly deposit calcium in here, and so on the x-ray what it looks like literally is a spur on the heel. But according to the orthopedist, when they actually remove that, if they are going to surgically remove that, they go in and they have to expose that heel spur to the air, because until it's been exposed to the air, it's the consistency of toothpaste. And it's just like mush, it's still soft. It looks hard on the x-ray because it's just resisting, the calcium is resisting the x-rays from actually beaming through, and so it appears as a spur. You'd think, oh, I can feel that, but you really can't feel it. It's just painful. And it's not like this, like on the, have you seen on a rooster where they get that spur and it's hard? That's why it looks like that type of a spurring appearance. But the fascinating thing is, when they actually take this person and surgically open this, it has to be exposed to the air before it will actually become solid enough that they can cut it or dissect it out. Kind of fascinating, isn't it? In some of the cases of this flowing hyperostosis or this ankylosing spondylitis, I've actually seen people that can still move and have a degree of movement in their spine. And what I have seen is that a lot of times this isn't hard bone that's forming down here. Again, it's the ligaments calcifying like the heel spur. And one of my friends did a research study back in Oregon where a fellow came in with ankylosing spondylitis, and he gave him traditional adjustments for 3 months straight, and the fellow was able to regain the range of motion in his spine. It was really phenomenal. This was a fellow who was 67 years old. When he came into the office, the ankylosing spondylitis had him walking like this, and he was in tremendous pain to even try to bend or move. And he continued to manipulate his spine and allowed those joints to finally be able to move, and he was actually able to start to bend again.
Is that
traditional?
Traditional.
So
the hard?
Yes, it was actually, and he was a strong guy. The chiropractor that I worked with, or that was my friend back in Oregon, and he was just manipulating with his hands. And he said, after it took him a little bit, he said the first couple of times when he would adjust him, it was like just bouncing off of bamboo. And he said it would just almost bounce back at him, but he just kept at it, and then he finally started to hear a little release or a cavitation again of the joints, and he started to open those joints up, and the fellow had tremendous relief, okay? But pretty phenomenal. Now,
So is that, you know, you see a lot of older people walking around like that. Is that usually what it is, or could it be some variety?
so the question is, when you see people with this type of humping posture, rounding,
Like they can't-
yep, and they can't stand up, usually you'll see more of an osteoarthritis. There's been a degenerative change. And most commonly, you'll see it in a male who's had degenerative disc disease in the lumbar spine or a compression fracture. Okay, he's lifted a bale of hay, and then, or he's been in a car accident where it used to be only a lap belt, and they've been thrown hard forward in a flexion injury, wreck over a four-wheeler, and they've been pulled hard into a flexion injury. The female who has then multiple compression fractures in the thoracic spine will start to develop that more often too. Okay, this was a lady who'd smoked for years, had advanced osteoarthritis in her spine and osteopenia, and in her case had her teeth. Okay, her teeth was where the infection was, so she had advanced osteoporosis in her spine. She was just bending forward to pick up the soap in her shower and felt something give, and she had 2 fractures in her spine at T8 and T10, and then another week later, so we got her x-rayed, referred her for a physician consult, neurosurgeon consult, and then another week later she had another one collapse in her lumbar spine. Okay, and then from there her posture became worsened significantly. Okay, I've seen though cases where people have paraglided or parachuted, had compression fractures in their spine, and actually maintained their height because they had good muscle tone to be able to maintain their upright posture. But so many people are already resting on their ligaments and bones that once they give way, it's almost like a domino effect, okay? And they pull into that. One of the greatest signs of health, if you actually look at it, is our body's ability to resist gravity, right? If you think about it, as we kind of lose our ability to resist our gravity, so does then our health deteriorate. And that's really a sign also of brain health. If you think about the person with the Parkinsonism, you know, as their brain is deteriorating, so does their ability to resist gravity and to be able to move or ambulate forward in that. Okay? So one of the best keys of window to brain health is posture, your ability to stand upright. When you start to see people with this real strong head forward carriage, you're actually looking at a person who has a strong sense of a posterior sway, meaning their center of pressure perceived by the brain is that they're falling backward, and because of that backward fall sensation, they'll actually try to resist that, and they'll get more head forward. Again, more of the Parkinson type of a movement. Okay, the stronger then in a young person that you see a posterior sense of sway, they'll actually start to claw the ground with their feet first. And so they'll be the ones that end up with the plantar fascial pain. Do you know anybody that's ever had plantar fasciitis? Of course. It's very painful, right? It's the podiatrist's #1 business, plantar fasciitis. And what we see with that is, again, the person perceives that they're falling backwards, so they're going to start to grip the ground to pull them forward. or hold them in a forward carriage. So again, the perception of sway and our body's ability to resist gravity is essential to our overall wellness.
So treating the brain to take care of that.
Yes. So the question is, so treating the brain can actually treat that or help to remedy or correct that. There's a lady that came to us from Ohio. She had terrible plantar fasciitis. She'd been given orthotics, couldn't play tennis anymore. That was her favorite thing to do. She had been in orthotics, physical therapy, terrible foot pain, terrible knee pain, couldn't walk on the beach anymore. That was her favorite thing to do, walk on the beach in flip-flops when she and her husband would go on a little Caribbean vacation. Came to us, and all we did is just worked with her brain. She called back a few days later, I don't have foot pain anymore, and then called back a few months later and said, I haven't had any more foot pain. Okay? Because it just corrected her perception of sway. That's pretty neat, isn't it? Just those little red and white strips. That's all she needed to fix her feet. But who would have thought?